In this video we are going to discuss a case scenario. So here, as you can see, a football player while playing football had an injury which caused severe shoulder pain of his left arm, and he was presented with his arm hanging down with some external rotation, and from an x-ray you found that it was not a fracture, and the head of the humerus is superimposed on the neck of scapula. So all these points, severe shoulder pain, presentation with the external rotation and supported by the opposite hand, and also the x-ray which clinches the diagnosis of shoulder dislocation. Okay, so what is the most likely nerve injured in case of shoulder dislocation? As you all know, axillary nerve, which is in proximity to the shoulder joint, so it is more likely to be damaged in case of shoulder dislocation. So in this video we are going to discuss about the basic anatomy of the shoulder joint, and also from this diagram, as you can see, this is the shoulder joint, and the joint which connects the upper limb with the trunk is the sternoclavicular joint. Okay, so in this video we are going to discuss in detail about the shoulder joint. As you can see, the shoulder joint is a type of a ball and socket type of the synovial joint. Okay, here the articulation is between the head of the humerus and the glenoid cavity. This glenoid cavity is from the scapula, so this bone is the scapula, this bone is the humerus. Okay, fine. Now I am going to tell some of the basic points which you have to remember. Okay, this bone is the clavicle, this is the scapula, this is the humerus. Now this part of the scapula is the coracoid process, this is the coracoid process, and this is the acromion process. Okay, so this joint, this ligament is called the acromioclavicular ligament, and this ligament is called the coracoacromion ligament, and between the coracoid and the clavicle there is again two ligaments, which is the conoid and the trapezoid. Okay, these are the various ligaments which you have to remember. And also within the shoulder joint it has three ligaments, this glenohumeral, superior glenohumeral, middle glenohumeral and inferior glenohumeral ligament. These ligaments provide support to the shoulder joint. However, the major support, the chief stability of the shoulder joint is maintained by the rotator cuff muscles, which we will discuss later in this video. This ligament is the transverse humeral ligament. Okay, fine. Okay, this one is the coracohumeral ligament. Okay, fine. Let's just move on to the next photo or the image. Okay, in this image we can have removed all the ligaments and have made the joint more visible. Okay, so as you can see, this is the head of the humerus, this is the glenoid cavity, and this rim like structure surrounding the glenoid cavity is called the glenoid labrum. Okay, it helps to hold the head of the humerus. Okay, and also as you can see from this diagram, it is very much evident that the head of the humerus is almost 3 times bigger than the glenoid cavity. So what is this clinical significance? This provides a wide range of motion, which in turn greatly affects the stability. So when you get this wide range of motion, you lose stability. There is a problem in the shoulder joint, so it is subjected to dislocation quite often. So which is our case for today. Okay, and another thing, important thing which you have to remember is this thing. This is the greater tuberosity, this is the lesser tuberosity. This gives insertion to the rotator cuff muscles. Having said that, let's move on to rotator cuff. So the rotator cuff is nothing but a set of muscles which surrounds and get inserted in the greater tuberosity and lesser tuberosity of the humerus, which in turn gives chief stability to the shoulder joint. Okay, so it can be remembered by the mnemonic SITS: supraspinatus, infraspinatus, teres minor, not major, teres minor, and subscapularis. So there are 4 muscles, of which 3 is inserted to the greater tuberosity. 3 muscles are attached to the greater tuberosity, which is the supraspinatus, infraspinatus. We can read it in the posterior view. I will show it. This is the subscapularis. This subscapularis is inserted in the lesser tuberosity. This subscapularis does not provide that much support for the rotator cuff, so it is also referred to as the forgotten muscle or the forbidden muscle. Okay, but now they have found out that subscapularis do provide some stability to the shoulder joint. So this is the posterior view. As you can see, this is the supraspinatus, infraspinatus, teres minor, which gets attached to the greater tuberosity. Okay, so when it comes to shoulder joint, you have to know about the anatomy of these spaces. This is the quadrangular space, this is the lower triangular space, and this is the upper triangular space. So this is in turn formed by these muscles and the humerus bone. Humerus, long head of triceps, teres minor and teres major. So this can be easily remembered with the help of this diagram. As you can see, when you keep your fingers, it comes like this. So here the upper, here the teres minor, this is teres major, long head of triceps and humerus. So what is the anatomical significance? The clinical significance is that the nerves and muscles which pass through it. So when you take this lower triangular space, it gives passage for radial nerve and profunda brachii artery. Okay, as you all know, they pass through the spiral groove of the humerus. Okay, that is quite important. And when you take this quadrangular space, this one is the this one is the quadrangular space. In quadrangular space, the posterior circumflex artery passes and also the axillary nerve. So in today's case, there was a question, which is the nerve injured in shoulder joint dislocation? So the answer is axillary nerve. As you can see, it passes very near to the shoulder joint. And also the circumflex scapular artery passes through the upper triangular space. So this is the anatomical significance of the spaces. So from this, we are able to conclude in brief about the shoulder joint and the related anatomy. In next video, we will discuss about the shoulder dislocation, which is the exact case.